2014 was a very active year for the Vermont Medical Society, but it was really the prelude to 2015 when the legislature debates its single-payer financing plan, and the VMS will be there constantly watching out for the interests of Vermont physicians and patients. The big healthcare reform bill that started to emerge, H. 596, at the end of the day was a very modest bill. Importantly, it defined what constitutes a non-emergency walk-in clinic and indicated that those clinics cannot discriminate against patients based on demographics or source of payment. And then the bill went on to require 5 or 6 different studies that will help inform the single-payer debate again in 2015. But it was a great year for the VMS. A number of important policy decisions were made, and we were pleased by the outcome of each of these different bills.
Medicaid reimbursement, a perennial Vermont Medical Society issue. This year, the 2015 state budget included a 1.6% increase in Medicaid reimbursement for Vermont physicians. The amount of this increase had fluctuated throughout the session week by week, depending on the funding source and also the other budget pressures, but it finally landed on 1.6, although the governor had initially requested 2.2%. The final increase was funded by a tax assessment on employers who don't offer health insurance to their employees, or employers who do offer health insurance to their employees, but their employees end up on Medicaid. So they will have an increased assessment. There was also a tobacco tax increase in the budget, which VMS supports for the public health reasons. Medicaid reimbursement is important to VMS for several reasons. First of all, it lags behind Medicare and other commercial insurance reimbursement and creates a cost shift. Secondly, the number of Vermonters covered by Medicaid has increased by about 66,000 since the Affordable Care Act increased the income eligibility for Medicaid. And finally, as Vermont moves towards health care reform, it's important for the physicians of Vermont to see the credibility of the state in establishing a reimbursement system that will cover costs. H350 covers 2 issues. It covers some medical practice board issues, and it also covers device education offered by manufacturers. So I'll start with the device education changes. H350 loosens Vermont's device manufacturer gift ban law and will permit Vermont physicians, nurses, and other professionals to attend educational sessions sponsored by manufacturers. Right now they can attend formal CME sessions where the CME program is accredited, but they are not permitted under Vermont law to attend sessions that are sponsored by manufacturers that aren't CME accredited. The law also permits manufacturers to provide food at these educational sessions. Vermont physicians who are attending their national sessions had found signs prohibiting them from entering or attending the sessions at their national conferences, and so and physicians report that particularly with respect to device education, these sessions, manufacturer-sponsored sessions, can be the only way to obtain this type of education. Vermont also is the only state with this prohibition. Massachusetts had a similar prohibition but repealed it a few years ago. The second issue on S350 is the Medical Practice Board. H350 requires the Medical Practice Board to remove from its website information about disciplinary charges that were dismissed by a court or a board. Those disciplinary charges usually remain on the website for 10 years. The bill also requires the board investigators to have 25 hours of continuing education every year and to obtain special certification in investigating licensing cases, which are different than criminal cases. Finally, the bill requires the board to report to the legislature on its investigation methods after accepting input from stakeholders such as VMS. This bill implemented a VMS resolution adopted at the annual meeting. H287 improves access to inpatient mental health treatment. Since Hurricane Irene in 2011, when the Vermont State Hospital flooded, the mental health system has been struggling and decentralized. Because of the lack of bed capacity for acute patients, seriously ill psychiatric patients ended up waiting in emergency rooms without treatment for days or in some cases for weeks. H-287 starts the commitment process in the emergency department for patients being held there. They will receive a psychiatric examination within 24 hours, and the state will be required to file the commitment application within 72 hours after that. Now the evaluation and petition and application are not started until after a bed is found and the patient is admitted. H-287 also expedites the hearings in cases where a hospitalized patient is dangerous to him or herself or others on the unit, and it also expedites it in some cases for patients who have had involuntary treatment in the past. Medication hearings can also be consolidated with commitment hearings in some cases. Finally, an automatic 30-day stay of enforcement of the court's involuntary medication order has been repealed. VMS hopes that these provisions lead to more timely treatment for psychiatric patients.
H-217, a bill that cleans up workplace smoking prohibitions and policies, and also includes a ban on smoking in vehicles with children under 8 years old, passed the legislature this year. We're very thankful to the General Assembly for their time and effort on this important legislation, and we are also thankful for our many partners who worked with us closely on this. The prohibition on electronic handheld portable devices, we thought this year actually was not going to make it through the legislative session, but in the last minute effort was placed on a miscellaneous Department of Motor Vehicles legislation, and so that passed. It does allow use of Bluetooth devices, or if you mount your cell phone on a dash, you can use it that way, but handheld phone calls and texting is all illegal, and we are very thankful for the General Assembly's effort on this, and we feel like this will make an important public safety and public health difference.